Good evening, everyone, and welcome to today's wonderful evening with Dr. Murali Bharadwaj. Today is May 7th. Today is May 7th. Still, we have a wonderful time. May 7th to June 7th, June 7th to June 22. So that would be almost 45 days more to go. And we have totally 50 grant tests. And now we are discussing the grant test number 13. So how do you make use of these full-scale NEETPG mock tests? Take the paper. 40 questions is a block. First 40 questions, you get image-based questions in all our mock tests. Solve it with a timer. Next 40 questions, third 40 questions, fourth 40 questions, fifth sets. Like Yvonne Lendl, Boris Becker, you play like a tennis game, the 5 blocks. Practice, practice, and practice. That's the only way by which you are going to win this NEETPG 2024 with in the top 1,000 ranks, no compromise. We should be in top 1,000 ranks. You dream about it, you eat about it, you breathe about it, but only one goal, to be the topper. You're going to join MD General Medicine, MS General Surgery. You're going to join the clinical dream branches, pediatrics. Some of you are going to be neurologists, neurosurgeons. Oh, the world is waiting for you to become the postgraduate. I always dreamed like that when I was preparing, that led me to become a topper. I made all my students who are preparing along with me to dream the same way I was dreaming, and I made them to become the toppers. In the past 25 years, 3 lakh medical students, I could get an opportunity to inspire them through the YouTube, face-to-face classes, video lectures, many ways. But ultimately, they're all toppers today. They're all practicing consultants today. Almost 2 generations of students. So you're also going to be that, the 3rd generation of the students in the next 10 years. You're going to be the one who will say, hey, one day I was thinking, how am I going to win the top rank? Then Dr. Murali Bharadwaj said, there's 50 full-scale grant tests, 10,000 MCQs. Let's do the practice with the mind maps of the explanatory answers. Can the online students can punch as the voice loud and clear, doctor? Ravinder and many more. So let us make the great beginning, doctor. Let's make the great beginning. A 45-year-old man presents with fatigue, weight loss, fullness in his left abdomen. And what is this peripheral blood smear is showing? Mature neutrophils. Some myelocytes are also seen, which is very typical of chronic myeloid leukemia. Thank you, Ravinder, and many more for the feedback. Right? So let us drop a line to all our friends. Let us drop a line to all our friends that Dr. Murali Bharadwaj आए और हमारा mock test का discussion शुरू हो गया. Please kindly inform your friends in the WhatsApp groups everywhere that the live class has started, and it is absolutely free. Only you need to pay to download the PDF of the ebooks. So let us make the great beginning, doctor. Please inform all your friends in the various WhatsApp groups. Now, chronic myeloid leukemia, everything, anything you should know, doctor. So peripheral blood smear, And how do you treat tyrosine kinase inhibitors? Imatinib mesylate is the one which you will use. BCR, ABL1 gene, everything, anything about the leukemia. 34-year-old reports of a persistent rash on her wrist. Persistent rash on her wrist. And whenever she is wearing the jewelry, so whenever you wear something and you have rash, patch testing is positive, then you will think about allergic contact dermatitis is your diagnosis, is what you should remember. A 6-month-old Asian descent discoloration, what is this called? Mongolian blue spot. Mongolian blue spot. And Mongolian blue spots are the congenital dermal melanocytosis, which are bluish gray birthmarks. And these spots are benign, they fade as the child is growing. That is what you need to remember. A newborn has this finding. So based on this finding, you should identify, right? It is a small axon fellows where there is a herniation at the umbilicus, where the abdominal wall is not completely closed, allowing the abdominal contents, like the loops of the bowel, to protrude into the umbilical cord, is what you should remember. Now, a preterm male newborn, this is what you are able to see, preterm. And the swelling is becoming more prominent when he is crying, which is indicative of bilateral inguinal hernias, is what you have to remember. During the labor, a 24-year-old in the second stage shows the fetal monitoring, which you are able to see here. So fetal monitoring tracing is one of the favorite questions of the examiner, which you should know how to interpret, doctor. So I'm very happy to see 10 online classmates, double-digit online classmates laboring along with us for the PG medical entrance, which is upcoming. You need to dream big. You need to dream strong. You need to dream that only you can achieve. Such a kind of feat is called NEETPG, doctor, taken by 2.5 lakh doctors, 2,50,000 doctors. You should be in the top 1,000 ranks, means no compromise. You need to be focused. You need to read the high yield topics. I will tell you what to read in the next 45 days. And hold your hand every day like a classmate, roommate, study mate to make you the winner in this tyrannical task called NEETPG battle. You need to fight in a warring spirit. During the labor, 24-year-old, this is called variable deceleration with a rapid onset of the recovery, with decreased variability. Fetal tachycardia. So always variable deceleration is a sign of the cord compression, is what you need to remember. So once more, early deceleration, late deceleration, variable deceleration, how do those curves look like? How to identify them, which type of deceleration in an image-based question? You need to be very, very sure about this, doctor. A 52-year-old typically presents over several months. He undergoes a laparotomy, and physiological examination is being shown to you. So what do you see here? Gelatinous metastatic tumor growth during laparotomy with the mucin producing tumor cells, which is very characteristic of pseudomyxoma peritonei, is the diagnosis. So now, doctor, seven-year-old child is being brought. Persistent rash, bone pain, unexplained fever. Biopsy had been done, and you are able to see tennis racket configuration, tennis racket, like Yvonne Lendl, Boris Becker, tennis racket होता ना, टेनिस रैकेट के जैसे दिख रहा है आपको बीरबेक granules, which is very typical of Langerhans cell histiocytosis is what you need to remember. And it is because of the proliferation of the antigen presenting cells. They infiltrate into multiple organs, leading to skin rash, bone lesions, etc. etc. Bhaiya, हर एक point about Langerhans cell histiocytosis आपके tips में रहना है if you have done this question wrong. So in one mind map, I leave all these questions, all the important points in one mind map. So 200 explanatory answers as 200 mind maps to give you the quick cursorial revision for the tomorrow's NEETPG. If you happen to do the revision of these 50 full-scale grant tests with Dr. Murali Bharadwaj, today only go to learnograph.com, download the full-scale grant test. Just by paying $500, you can download it. And you can share it also to a few of your friends, no problem. But all of you sit together, solve the question paper, discuss the questions, and every day become better. That's the goal of me. 30-year-old male with painless mass in his left testicle. Right? You need to identify the histology. Ultrasound shows 2 centimeter intratesticular lesion. Homogeneous ecotexture, very important clue. AFP normal, beta HCG levels are normal. So this is a very classical feature of Sertoli cell tumors that present like a firm, painless testicular mass is what you should remember. 38-year-old women, 38-year-old women, वो पिक्चर देखते ही आप बताओगे that is Graves' disease with Graves' ophthalmopathy with thyrotoxicosis. 68-year-old male with the history of recurrent infections comes to the clinic. Macrocytic anemia, neutropenia, a bone marrow biopsy, it shows nucleated red blood cells. Okay, so multilobated nuclei that suggests myelodysplastic syndrome. So once more, what is the definition? What are the clinical features? What are the dysplastic changes? How do you make a diagnosis and treatment? Hypomethylating agents for higher risk patients we give in the treatment. Allogenic stem cell transplant is required for the myelodysplastic syndrome is what you need to remember. Right, doctor? So can the online students can punch? Is the voice loud and clear for all of you, doctor? Please punch. 23-year-old man. Lumpy, bumpy neuroma. Lumpy, bumpy neuromas is what you're able to see. Marfanoid habitus is there. All these neuromas are there on the lips, tongue. Similarly, on the eyelids. So it is meant to be where there is a predisposition to medullary thyroid carcinoma and pheochromocytomas. That is meant to be. One question on Men's syndrome, sure shot. 55-year-old with the decreased visual clarity, sensation of grittiness in the eyes. On examination, you are able to see what is this called? Band keratopathy, which is typically a calcium deposition in the corneal stroma. Right? Nice to see, Kuldeep. Thanks for the feedback. Loud and clear, sir. Very good. So, gray-white opacification, that is what you're able to see. So you should know everything about what is the etiology. Any hypercalcemia can cause band keratopathy. Chronic uveitis can cause band keratopathy. Renal failure, sarcoidosis. In all these situations, there is a band keratopathy is what you should remember. 2-year-old child is being brought. You're able to see the penile curvature. So it is hypospadias with the cordy is what you should basically remember. Hypospadias with the cordy. Classical image-based MCQ. Tomorrow's NEETPG, at least expect 50, 60 or 70 questions coming image-based is not uncommon. Expect almost all 200 questions may at least 160, 170 are going to be clinical minute-based questions. Accordingly, you need to put a timer and practice for the tomorrow's NEETPG exam, doctor. Now, a 30-year-old, 3-month history of night sweats, unexplained weight loss, swollen lymph nodes, binucleated Reed Steinberg cell. Reed Steinberg cell. Where do you see Reed Steinberg cell? Bilobed Reed Steinberg cell. Hodgkin's lymphoma with the mixed cellularity type is the underlying diagnosis, is what you should remember. A postmenopausal woman presents with a pelvic mass, right? So before coming to the session only, try to download the question paper. I'll give you a free PDF without answers. Solve it and then go to the online video library, to the learnograph.com, and from there you download. So a postmenopausal woman presents with a pelvic mass. Imaging shows gross appearance. So solid, firm, white mass in the ovary of a postmenopausal woman, along with the plump stromal cells with fibrous appearance, is very typical of ovarian fibroma, is what you should remember. A 58-year-old woman presents with a history of progressive back pain, increasing difficulty in breathing. So this is kyphoscoliosis, where there's a lateral and outward spinal curvature leading to the development of the back pain, is what you need to remember. A 28-year-old pregnant woman evaluated for her first delivery, and during a pelvic examination, obstetrician estimates the measurement done like this. What is this measurement? Diagonal conjugate. So a diagonal conjugate of 11.5. So 11.5 measured like this minus 1.5 to 2 means the diagonal conjugate is 9.5 to 10. That says that it is adequate pelvis, is what you have to remember. 52-year-old with jaundice, dark urine, pale stools, percutaneous transhepatic cholangiogram is being done, and dilated bile duct is there. So what is the finding? Dilated bile ducts, filling defect, the presence of the filling defect, which is indicative of the obstructive jaundice. And you need to do ERCP with an attempt to remove the stone, is considered to be the treatment of choice. A patient has a history of recurrent infections. A CBP is being done. What is this called? Neutrophils with bilobed nuclei. Neutrophils have bilobed nuclei. And what is that called? Pseudo-Pelger-Hute cells, along with fatigue, recurrent infections, and dysplastic changes in bone marrow biopsy. So that is all indicative of myelodysplastic syndrome is what you have to basically remember. A 65-year-old man with a history of coronary artery disease with palpitations, lightheadedness, ECG is being shown to you. So there is a broad complex tachycardia. QRS complex is broad complex tachycardia. A broad complex tachycardia, unless proven otherwise, is equal to ventricular tachycardia. And the patient has an underlying heart disease. That's the reason initial treatment will be intravenous amidanon is considered to be treatment of choice, is what you should remember. Once more, VT, what are the ECG characters? Broad complex tachycardia. That means QRS more than 120 milliseconds. Extreme axis deviation. Concordance in precordial leads. That is all QRS complexes either predominantly positive or predominantly negative. Dissociated P waves. P waves and QRS complexes are not associated with each other. They're all indicative of typically ventricular tachycardia is what you need to remember. A 54-year-old woman presents with the weakness of her face, which is being shown in the figure. So, what is the most likely location of this lesion? So, left-sided facial weakness with the sparing of the forehead suggests an upper motor neuron lesion, which is typically causing the damage to the contralateral cerebral hemisphere. So, the right side of the brain controls the lower muscles of the facial expression of the left side of the face. That is what you need to basically remember. A 64-year-old male with a visible involuntary twitching of the tongue and progressive difficulty in speaking. Right? His medical history has a gradual weakness over the past year. So tongue fasciculations, progressive muscle weakness, they're all suggestive of motor neuron disease. Electromyography is the key tool, is what you need to remember. A 52-year-old with unilateral tongue weakness, and whenever he is protruding, there is a unilateral deviation. So the deviation towards the right side suggests right hypoglossal nerve involvement. Understand, doctor? Very important to know. It is a right hypoglossal nerve palsy is what you need to remember. A 68-year-old man is brought to the neurologist. His family says he has a recent inability to assemble simple puzzles like this. Suppose you ask him to draw, he is drawing like this. So what is this called? Constructional apraxia, which is a characteristic feature whenever there is any lesion in the parietal lobe. Parietal lobe dysfunction lead to constructional apraxia is what you have to basically remember. Constructional apraxia. So, please inform your friends, doctor, that the live discussion has started, right? And earlier we used to remove the live discussions in order to push the people to come to the live and do the discussion along with us. So, what is clock test? Very good question, doctor. So, whenever there is any hemi neglect, you ask the person to draw a clock. Half of the clock is not drawn, only half is drawn, which is then called a positive clock test due to hemi neglect, right? Now, doctor. So a 12-year-old with clinical features which are being shown. So there is a pectus carinatum with a Harrison sulcus. So you need to be very sure. Pectus carinatum is due to abnormal growth of the costal cartilage. Typically, whenever there is any chronic respiratory disease or whenever there is any rickets, you get this kind of an appearance. A woman is in labor and she has a difficulty with the delivery of the fetal head at crowning. And what is this maneuver being done? It's called Ridgen's maneuver, where the obstetrician using one hand to apply gentle upward pressure from behind the perineum, supporting the fetal chin, while the other hand applies a counter pressure to the occiput to control the delivery, right? Supporting the fetal chin. So this is done for the delivery of the head. This is different from McRobert's maneuver. That is flexing the mother's leg towards her abdomen to alter the angle of the pelvis. That's what you need to remember. So, Ridgen's maneuver, Marshall-Marchetti Grant's procedure, all these things you need to be good doctor. Now, a 76-year-old suffered a right hemispheric stroke. Only half of the clock only she is able to draw. So constantly ignoring one side. That's called spatial neglect is what you need to remember. So once more, parietal lobe is very important for our constructional praxis and also for preventing heavy neglect is what you have to remember. Now, a 40-year-old graphic designer complains of numbness in her thumb, difficulty lifting the thumb to the side. So this is called pen touching test, which is the test of the abductor pollicis brevis, typically caused by the compression of the median nerve in the conditions like carpal tunnel syndrome is what you have to basically remember. A postmenopausal woman with vaginal bleeding. So what do you see here? Call Exner's bodies and immunohistochemistry positive for the inhibin characteristic of granulosa cell tumor. Typically, granulosa cell tumor produces a loads and loads and loads and loads of estrogen, which lead to the development of precocious puberty is what you need to basically remember. Now, doctor, a patient presents with the numbness in the distribution that is being shown. So this is the distribution of the nerve supply of the territory of the common peroneal nerve. Whenever it is injured, whenever there is any compression at the fibular neck, like in fibular neck fracture, you get the numbness in this distribution. A 32-year-old has a difficulty for raising his arms and a noticeable inability to fully smile, right? So this is called facioscapulohumeral dystrophy, progressive facial muscle weakness, upper body muscle weakness, autosomal dominant inheritance. All this is suggestive of facioscapulohumeral muscular dystrophy. It's called Popeye appearance. That cartoon figure Popeye will be there, like that. A 42-year-old presents with the findings which are being shown to you. There is an increasing weakness, is what you are able to see in his shoulders and hips. So this is classical of dermatomyositis. What you are able to see here? Heliotrope rash, Gottren's papules, which are the feature of dermatomyositis, is what you need to remember. 30-year-old, painless swelling in the left testis. Ultrasound shows a complex mass. What is this called? Schiller dual body. Typically, they resemble glomerulus with a central vessel surrounded by germ cells with elevated AFP level with a complex testicular mass, which is indicative of yolk sac tumor, is what you need to remember. Very good to see 7 online classmates, doctor. Very good. Now, 46-year-old man, what can you see? There is a baldness, cataracts, right? Myotonia, muscle wasting, delayed relaxation. If he gives a shake hand, it's very difficult to get rid of his hand from your palm, right? So that is myotonic dystrophy, is what you have to remember. So this is an example of myotonic dystrophy. There is a partial ptosis, cataracts, temporalis muscle atrophy, proximal muscle wasting, gynecomastia, forearm wasting, baldness, triangular faces, right? Sternomastoid atrophy, cardiac failure, percussion myotonia, glycosuria, testicular atrophy. So next time you find your bald friend, don't look at him with suspicion, right? Yeah. So now, doctor, this question got repeated. Yes. Now, a liver biopsy from the patient with chronic hepatitis B. So what is this called as? Ground glass hepatocytes, which is a feature of chronic hepatitis B. Chronic hepatitis B. You need to be very sure to identify the histology. Similarly, a bone marrow aspirate in a 40-year-old patient. He is also having coagulopathy. So, which acute myeloid leukemia is known to lead to development of disseminated intravascular coagulation, doctor. It is the acute promyelocytic leukemia. M3 variety is the one. It has got eosinophilic granules, bilobed nuclei, needle-like or rods. Can you see that? So this is called or rod. Presence of needle-like inclusions are called or rods, which is the classical feature which is seen in acute promyelocytic leukemia. During the liver biopsy of a patient with a history of hepatitis C infection, what is this indicative of? There are lymphoid aggregates expanding the portal triads with the development of a bridging fibrosis, which is characteristic of chronic hepatitis C infection, is what you need to remember. So you should know portal tracts expanded with lymphocytes. Aggregates of lymphocytes infiltrate the liver, which is very classical. And delicate bridging fibrosis is very, very important to remember. A 45-year-old with fatigue, diabetes, liver disease, joint pain, and what can you see? Iron deposition, very classical of hereditary hemochromatosis, is what you need to remember. Hereditary Prussian blue staining. You can identify the hemosiderin deposition. Now, doctor, special newborn care units. From here we can run. We finished the first 40 image-based questions, doctor. SNCUs are very important to provide a specialized care for the sick and low birth weight babies. Matru Vandana Yojana. It is basically aimed at providing partial wage compensation to ensure that the women take adequate rest before and after the delivery. Now, if you look at the whole bread, grain bread, it has a lower glycemic index compared to white rice or candy. Now, whenever there are 1500 workers, the factory should have at least one safety officer for every 1000 workers. Therefore, this requires 2 safety officers. So what is the most appropriate design for testing a new treatment versus vis-a-vis placebo? It is a randomized controlled trial. So what is section 498A? Right? So the dowry related offenses. Dowry death is 304B, 10 years life imprisonment. Dowry Prohibition Act, 5 years imprisonment and fine of 15,000 under 498A. Punishment for avoiding summons is 172, 1 month jail. Non-attendance to summons is by section 174. And 498A deals with the cruelty by the husband or relatives towards the wife, and it stipulates imprisonment of up to 5 years and a fine. Section 304A of the IPC falls under bailable offences, allowing for the possibility of bail is what you need to remember. So non-bailable offences 302, 304B, 307, 326. Even if you want to be a cardiologist, neurologist, whatever isht, you have an ishq of becoming that, still you need to read these so-called offenses until you get the top rank. Right? Now, a physician is brought before the State Medical Council accused of advertising his private clinic services. There is a violation of medical ethics. Advertising that misleads or falsely represents the medical services violates the Code of Medical Ethics and constitutes a professional misconduct, is what you have to remember. A forensic anthropologist is examining a skeletal remains. So the closure of the antler fontanelle occurred by 6 months of age, and sagittal suture closure does not typically begin until 18 years of age. Right? And because the sagittal suture is still open, it suggests that the individual was likely not older than 21 years at the time of death. Now, palato prints you can use to identify the individuals by comparing the pattern of the palatal rugae with the dental records is what you should remember. Rigor mortis begins 1 to 2 hours after the death and takes further 1 to 2 hours to develop, and it progresses in a proximo-distal order according to Niston's law. So doctor, with this आज के हमारे सभा को समाप्त करेंगे. आप रोज अपने आप टेस्ट कर लें. My job is to give you a simulating test, almost 100% strike rates, similar to what they ask in the tomorrow's NEETPG. Right? Your job is to take the test like a test. कहीं भी आप कोचिंग लो, किसी भी ऐप में आप मेंबर हो, कहीं भी आप फेस टू फेस हो या वीडियो क्लासेस हो, कुछ भी हो, but you need Dr. Murali Bharadwaj to be your classmate to solve the full scale grand test and discuss with you. So रोज मिलेंगे, रोज पढ़ेंगे, रोज एक मॉक टेस्ट सॉल्व करो next 45 days. आपका तबीयत खुश हो जाएगा, आपको समझ में आएगा what examiner is looking for you. Good luck for exam and prepare with high spirit. Good night.